Happy Tuesday. How's everybody doing? It's not a good start to my morning, but whatever. It is what it is, right? So here I am on my morning commute, my Tuesday morning commute. Just wanted to come out and talk to everybody a little bit. I posted a question that deals with depression, medication, and suicidal ideation. And as I'm reviewing the questions and checking out how everyone answered, I can see that this one was a tough one. And I get it. I think it was tough for a couple of reasons. So I wanted to come out and talk about this just a little bit quickly. So here's what I want to put in your mind, okay? So there was a couple of keywords in this particular question, right? And so the first keyword was, let me see here. Okay, so it said, of the following, which is likely to be considered as the most immediate factor and about which to inquire with a client who has a long history of depression and treatment with medication and psychotherapy in assessing his or her report of a recent abrupt onset recurrence of suicidal ideation. So the two keywords that stood out for me, one was inquire, and the second is abrupt. Okay, so one of the things that's really important to remember when you're thinking about doing your biopsychosocial assessments or interviewing a client, or this appears to be in my mind a client that you already have a relationship with, and this client was coming in and noting some changes in his or her behavior, right? And so the important piece here is to be able to kind of fizz through that. Now, I know one of the things that we're kind of taught when it comes to suicidal ideation is if a client is depressed or feeling sad or low about something, then what we want to do is go ahead and assess for suicidal ideation based on those criteria. But here, I don't think we're talking about a situation where a client was having a long-term situation where he or she was feeling depressed or down about something. In this situation, we're dealing with a client who had an abrupt change. Keyword abrupt, meaning it was quick and it was an onset of a behavioral change. So it's not like the client was experiencing something already intrinsically internally and dealing with depression, but it appears to be that based on something that was going on in this client's life, there was a shift, a change, a quick change, an abrupt change. And you're inquiring about some things to try to figure out what made this change occur so abruptly, okay? Now, when dealing with psychotropic medication, I'm not a psychiatrist, so I don't deal with medication. I don't, treat for medication, don't write prescriptions for medication. But as clinical social workers, as social workers in general, it's important for us to understand some concepts about pharmacology and medication and how it can impact the lives of our clients, because a lot of our clients may be, prescribed medication. So here it is. When you have a client that's on a medication and the medication has changed, it's always important, regardless, it's always important to assess for those shifts and those changes. So the first thing you want to do in this situation is assess and ask those questions about any changes in the medication. Ask about any changes in the client's medication. Did they change the dosage? Did they change the brand? Did they change the type of medication? Because this can have an impact on what the client is experiencing and feeling. Okay, so make sure you take a good look at the explanation that I posted in the comment section, and also in this video. What I'm going to do, I'm going to post a link that will take you to an article that gives some really good information of real life situations of where individuals who are taking medication, their medication has changed, and as a result they experience some suicidal ideation and they're no longer with us. And that's, of course, that's heartbreaking, but these things are really important because these are kind of like side effects that an individual may experience. I know for myself, in my own practice, when I have a client and they come in, one of the first questions that I go over, I want to always make sure that the medication that they originally told me about when they came in, they're still on, or checking to see if any changes have been made, if the dosage went up, if they came off and went on to a different type, or if they're no longer taking the medication. And then I'm always assessing and asking for any changes in feelings, emotions, behavior. And if so, then we're documenting that, and we're making sure that we're following up with the psychiatrist to make sure that they're informed and they understand that there's some changes, so that we can continue to monitor. It's so important to make sure that you monitor any changes in medication, for the simple fact because of the side effects that a client may experience, and the fact that it may impact suicidal ideation and suicidal attempt. I hope this was informative, I guess. I hope it was helpful. I hope it gave you some kind of insight, and I am going to put the link in here, so just click the link, read the article, and leave me some feedback if that's helpful. Have a great day, and I'll talk to you soon. Bye.